So I'm going to do the methodology here. Ethical considerations were addressed because they could not conduct a quantitative study due to the fact that withholding fall precautions after a risk assessment would be considered unethical. This was a qualitative phenomenological study because they conducted interviews and focused on the participants' perspective to build a database. Deductive reasoning was used in the study because they were trying to find new facts based on the information they collected. The study conducted 4 audio-taped focus-style group interviews with a random sample of registered nurses and nursing assistants at 4 acute hospitals, 2 urban academic medical centers, and 2 suburban teaching hospitals in the same hospital system. The investigators chose a probability sample. The sample size included 23 registered nurses and 19 nursing assistants from the 4 acute hospitals. The registered nurse studies population consisted of mostly women at 91%, white individuals being at 96%, at age 24 to 68 years, with the median age being 39 years, and educated at the BSN or MSN degree holders equaling 16, and had 1 to 40 years of experience, with the median years being 12, with a median of 10 years in the participating hospital. The nursing assistant study population consisted mostly of women at 79%, African American or Black at 63%, aging from 30 to 62 years with the median age being 49, and having 4 to 16 years, with the median being 12, of formal schooling, and 2 to 25 years, with the median being 10 years of experience as a nursing assistant, with a median of 7 years at the participating hospital. This study is reliable considering the median amount of experience at the bedside of each registered nurse and nursing assistant had. The subjective views of the population created the database. Data analysis. The raw data was first transcribed into Microsoft Word. It was then corrected for transcription accuracy, and finally it was converted into the NVivo software program. Afterwards, basic analysis methods were used to interpret the descriptive data. The concepts were then linked to discover new views from the counts of the participants' experience. After the data was formulated, 6 concepts were found to have both positive and negative components that contributed to patients falling, and suggestions to prevent patients from falling are as follows: patient report, information access, signage, environment, teamwork, and involving patient/family. Researchers found that with the presence of protective factors such as knowledge about falls, communication among the healthcare team, patients and family, and tailored actions carried out to prevent falls individualized to each patient, the likelihood of patient falls and falls with injury would theoretically decrease. This is the summary. The study is described as a qualitative phenomenological study. This was a good choice for the investigators because of their intent to gather and record the nurses and nursing assistants' response without researchers' influence. They chose a small sample from the same hospital system, which may have influenced the responses and made the data inaccurate. This limited the responses to the hospital system where the research took place. If they would have increased the sample size and selected nurses from multiple hospitals, it may have increased the chance of different accounts of the same interview. The strengths of this research was the amount of years each nurse from their sample had spent at the bedside. 1 to 40 years for registered nurses and 2 to 25 years for nursing assistants, which could have been at the current hospital or hospitals where they were previously employed. This strengthens the research because the number of years experienced at the bedside increased the amount of falls each participant could have encountered. Credibility is accurate because all the interviews were audio taped and reviewed for accuracy of transcription to their database. Because most hospital policies regarding fall precautions are similar, the researchers can generalize the findings to other populations. This study, the views and insights of caregivers were gained regarding challenges in preventing falls in accurate care hospital settings. The researchers found suggestions for policies and practices that could easily be implemented. They could create a variety of pictograms that were specific to patients, fall prevention that could be used. A predictive model was created that outlined strategies to promote fall prevention. This research showed some ways to help nursing executives decrease the amount of falls and provide suggestions for future researchers. Thank you.